Anemia, the lazy disease. Anemia is a global public health problem affecting both developing and developed countries. What is anemia? Anemia is defined as an abnormal reduction in the number of circulating red blood cells, the quantity of hemoglobin, and the volume of packed red cells in a given unit of blood. Normal values of hemoglobin in blood for females it will be around 12 to 16 gram per deciliter, and for males it will be around 14 to 18 gram per deciliter. When you are anemic, your hemoglobin values will be less than 12 gram per deciliter for females and it will be less than 13 gram per deciliter for males. If hemoglobin in blood is around 10 to 12 gram per deciliter, it is mild anemia. And when it is between 7.1 to 9.9 gram per deciliter, it is moderate anemia. And when it is less than 7 gram per deciliter, it is severe anemia. This pie chart shows anemic levels in school children of 5th to 12th standard, in which 60% of the population are girls and they are anemic. The tabular column shows cutoff levels of hemoglobin for diagnosis of anemia. Now, what are the causes of anemia? The etiology of anemia is the result of wide variety of causes that can be isolated but more often coexist. Iron deficiency has been the most prominent cause for onset of anemia, whereas other causes identified include heavy blood loss as a result of menstruation or internal bleeding due to peptic ulcer or parasitic infections. In addition to this, micronutrient deficiencies including vitamin A, B12 in vegetarian diet, folic acid and copper can increase the risk of anemia. Lack of intake of fruits and vegetables in diet also contribute to poor health status. Anemia is most common in females, especially during their teenage and pregnancies, because of their increased blood loss during menstruation and due to increased iron demands of the fetus. So, what are the symptoms of anemia? Feeling weak or tired all of the time, shortness of breath, increased susceptibility to infections, cold hands or feet, pallor or pale skin, eyes, etc., fond of eating ice, lightheadedness. Now, what is the role of dentist here? Oral cavity is a reflection of physiological, social, psychological factors that are essential to our quality of life. Dentists can easily find out anemia by looking at your mouth. What all signs dentists see? Let's see. Fissures in the corners of the mouth, also known as angular cheilitis. Dryness of the mouth and lips, also known as xerostomia. Shiny appearance of the tongue, taste alteration, loss of taste buds leads to glossitis. Burning mouth. Recurrent ulcers in the mouth, also known as aphthous stomatitis. Paleness of the mouth, which is mucosal pallor. Most common fungal infection which occurs in the mouth, known as candidiasis, caused by Candida albicans. When you get anemia treated, your mouth will be free of all these symptoms. How to treat these problems due to anemia? Always we need to get the root cause treated. First of all, consult your dentist and get your physician's advice. Get your blood levels checked. Complete blood count, vitamin B12, folic acid levels and investigation for the underlying diseases. There is a range of treatments for anemia. Each treatment aims to increase the number of red blood cells, in turn increases the amount of oxygen carrying capacity of the blood. For every problem, there is a solution. Anemia can also be treated. We can also prevent anemia by taking iron-rich foods like dry grapes, spinach, egg yolk, green peas, chicken, liver, etc. Some of the natural sources of vitamin B12 are eggs, salmon, chicken, milk and dairy products, mushrooms. Foods rich in folic acid are orange, broccoli, nuts, dry fruits, papaya, lady's finger, banana, etc. If you are a vegan, check your vitamin B12 levels regularly and go for vitamin B12 rich foods and supplements. Visit your physician and get regular checkups, screening and treat the underlying diseases. So, the treatment for moderate anemia is iron supplements under the advice of your physician. For severe anemia, consult your physician and go for blood transfusions. Important dental consideration is tooth removal should not be done for patients with severe anemia. Hence, this video is to share about anemia and the importance of dentist role in identifying this disorder. Stay strong like iron, which is a blood mineral. Thank you for watching.